Today, let us talk on a very important topic for man above 45 years. On the topic, benign prostate hypertrophy, BPH breakthrough. A new non-surgical treatment for urine flow, night trips and sexual strength. If you're a man over 45 and you're struggling with weak urine flow, frequent night trips or reduced sexual strength, don't rush for surgery. A breakthrough in prostate enlargement treatment is helping thousands of men restore control, naturally and safely. And today, I'll show you exactly how it works. Introduction. Benign prostate enlargement, BPH, is one of the most common health issues men face after the age of 40. Symptoms include frequent urination, nighttime urination, weak flow, alexancy, complete emptying, dribbling, sexual weakness. Most men believe this is purely a prostate problem, but the truth is, it's not. But new research shows something important.
Many BPH symptoms come from pelvic floor muscle weakness, not just prostate enlargement. And the good news is, pelvic floor strengthening, especially through the pelvic chair, HIEMT, can significantly improve these symptoms without medicine or surgery. Today's lecture will explain how. Chapter 1. Understanding the male pelvic floor. Most men have never heard of the pelvic floor, but it plays a critical role in bladder control, urine flow, state support, sexual function, erectile erection strength, ejaculation control, lower back stability, pelvic circulation. The pelvic floor is a muscular hammock at the bottom of the pelvis. If this muscle becomes weak, bladder support becomes poor, urine control reduces, prostate congestion increases, erections become weaker, pelvic pressure increases, nighttime urination becomes common, wrist feed after urination begins. Many of these symptoms are identical to BPH symptoms. Chapter 2. Why pelvic floor weakness happens in men. Several factors weaken the pelvic muscles. Elevation, especially 50 plus. Ephromicity, chronic constipation, IBH and poor back weakness, lack of exercise, repeated lifting, prostate enlargement, prostate surgery, steam rest and poor circulation. When these muscles weaken, the bladder and prostate are not properly supported. This leads to symptoms that many men assume are prostate issues, but actually they are caused by muscle dysfunction. Chapter 3. How pelvic weakness mimics BPH. Weak pelvic muscles cause weak urine flow because the bladder has poor exit support. Post-void dribbling because the pelvic floor cannot contract sharply. Nighttime urination because the bladder does not empty fully. Urinary urgency because nerves become oversensitive. Frequent urination because pelvic muscles fatigue quickly. Groin heaviness or pressure because the pelvic system is unstable. Icing erectile dysfunction because pelvic muscles help maintain erections. Premature ejaculation because pelvic muscles control ejaculatory timing. These symptoms overlap almost exactly with BPH, which is why many men get treated only with medicine but do not improve fully. Chapter 4. Why strengthening the pelvic floor is critical for men. A strong pelvic floor supports the bladder, flow, reduces night urination, embarrassment dribbling, enhances erection hardness, prebes ejaculation control, Advocated prostate congestion. Upstabilizes the core and lower back. Implicated blood circulation to pelvic organs. This is why pelvic floor strengthening has become a major part of modern urology and men's health clinics worldwide.
Chapter 5. How the pelvic chair, HIEMT, works. The pelvic chair uses high-intensity focused electromagnetic stimulation to create 12,000 plus supramaximal pelvic floor contractions in one session, stronger than any exercise possible voluntarily. These contractions rebuild pelvic muscle mass, lengthen the urinary sphincter, improve bladder emptying, restless pelvic nerve control, increase blood flow around prostate, remend congestion, improve erectile support, calibration sexual energy and confidence. This technology reaches deep pelvic muscles that men cannot exercise manually. Chapter 6. Benefits for men with BPH symptoms. 1. Stronger urine flow. Not by shrinking prostate, but by improving pelvic support and bladder pressure. 2. Reduced nighttime urination, because bladder empties more completely. 3. Less urgency and frequency. Pelvic nerves become calmer and more controlled. Better control of urine stream. Stronger closing pressure, fewer accidents. Resolved post-void dribbling, one of the most common improvements. Relief of pelvic heaviness. Improved circulation and muscular support. Reduced prostate congestion. Blood flow improves, reducing swelling pressure. Reduced need for medication, especially for mild-moderate symptoms. Delay or avoid surgery, because symptoms improve naturally. This is why many urology clinics worldwide have added pelvic floor stimulation to their BPH treatment programs. Chapter 7. Benefits for male sexual health. Better erection hardness. Pelvic muscles help maintain rigidity. Improved duration. Better support of blood flow. Better control over ejaculation. Stronger rhythm muscles, longer lasting. Increased orgasmic intensity. Pelvic contractions become stronger. Cramped penile blood flow due to deep pelvic circulation. Greater sexual confidence as control and performance improve. Many men notice improvements within 4 to 6 sessions. Chapter 8. Who benefits the most? Men over 40. Men with BPH symptoms. Men with nighttime urination. Men with weak urine flow. Men with dribbling after urination. Men with pelvic heaviness. Men with erectile weakness. Men with premature ejaculation. Men after prostate surgery with clearance. Men with long sitting jobs. Men with chronic constipation. Men with weak lower back. These men often respond extremely well. Who should avoid it? Contraindications. Pacemaker, a repaired inguinal hernia, severe prostatitis flare, pelvic infection, etal implants in pelvic region. Otherwise, it is very safe. Chapter 10. Treatment course. Initial phase, 4 to 6 weeks. 2 sessions of week, slashing 20 to 25 minutes. 50 to 80% intensity as tolerated. Stabilization phase, next 4 to 6 weeks. Calibration, 1 session of week. Maintenance phase, once every 2 to 4 weeks to maintain strength and prevent relapse. Chapter 11. Realistic expectations. Men often notice reduced night urination in 2 to 3 weeks.
stronger flow in 3 to 5 sessions, preserved sexual strength in 3 to 6 sessions, deduced dribbling in 1 to 2 weeks, paralysis control improvement in 6 to 8 sessions. Your own experience perfectly fits these timelines. Conclusion. Pelvic floor strengthening is a powerful non-surgical tool for men with reduced pH symptoms, urinary problems, start time frequency, dribbling, poor flow, elastic hiatal weakness, misplaced ejaculation, NP-pelvic heaviness, strata instability, sexual dysfunction. The pelvic chair does not shrink the prostate, but it dramatically improves bladder support, nerve control, and pelvic circulation, leading to real improvement in quality of life. For many men, this therapy fills the gap between doing nothing, taking lifelong medicines, and jumping directly to surgery. It offers a natural, safe, effective way to restore pelvic strength, bladder control, and sexual vitality. The good news is that this facility is now available at Holistic Wellness Foundation, Imphal. In your service, Holistic Wellness Foundation, Imphal. Healing beyond boundaries.